Hey everyone, and welcome back to Visions Beyond. Don't forget to like, share, and subscribe so we can keep bringing you these fascinating deep dives. Today we're going to be taking a closer look at the surprising connection between sleep apnea and diabetes. We've got three great sources for this one. An article from the American College of Chest Physicians called Obstructive Sleep Apnea and Diabetes, a state-of-the-art review. An article from the National Library of Medicine called Sleep Apnea and Diabetes, Insights into Emerging Evidence, and a press release from the American Academy of Sleep Medicine called Patients with Type 2 Diabetes or Hypertension Must Be Evaluated for Sleep Apnea. Get ready for some eye-opening insights because this connection is a lot more significant than most people realize.
It really is. Yeah, for a long time. These two conditions were viewed in isolation, but research is revealing a complex interplay between them that has major implications for how we approach both prevention and treatment.
Okay, so before we jump into the deep end, let's make sure we're all on the same page. Can you give us a quick refresher on what sleep apnea is and how it affects the body?
Sure, sleep apnea is a sleep disorder characterized by repeated pauses in breathing during sleep. These pauses happen because the airway becomes partially or completely blocked, leading to drops in blood oxygen levels and disruptions in sleep.
So it's like your body keeps hitting the snooze button on breathing throughout the night.
Exactly. And this puts a lot of stress on the body systems, especially over time.
Now, when we talk about diabetes in this context, we're primarily focusing on type 2 diabetes.
Yes, that's where the bulk of the research lies. Type 2 diabetes is a condition where the body struggles to use insulin effectively, leading to elevated blood sugar levels. And what's fascinating is that the prevalence of sleep apnea in people with type 2 diabetes is shockingly high.
Just how high are we talking?
Studies suggest it could be as high as 70%. That means a significant majority of people with type 2 diabetes also have sleep apnea.
Wow, 70%. That's a huge number. I had no idea the overlap was that significant. It really makes you wonder if there's something more to this connection than just coincidence.
That's exactly what researchers are trying to understand. Could sleep apnea actually contribute to the development of type 2 diabetes?
So it's not just a matter of two common conditions happening to coexist in the same individuals, but potentially a cause and effect relationship.
That's the emerging hypothesis, and it has profound implications for how we think about both conditions.
What's the evidence pointing in that direction?
Several large-scale studies have shown a link between sleep apnea and an increased risk of developing type 2 diabetes, even after accounting for other known risk factors like obesity and family history. For example, the Nurses' Health Study, which tracked a large group of women over many years, found that even short sleep duration could increase the risk of developing type 2 diabetes.
So even if someone isn't formally diagnosed with sleep apnea, just having consistently poor sleep or not getting enough sleep could put them at a higher risk.
Precisely. And that's something we all need to be mindful of, especially in today's fast-paced world where sleep is often sacrificed.
But what is it about sleep apnea that might trigger these metabolic changes in the body
Yet,
and increase the risk of diabetes?
researchers believe that the repeated drops in blood oxygen levels, known as intermittent hypoxemia, and the constant disruptions in sleep, called sleep fragmentation, both hallmark features of sleep apnea, are the primary culprits.
Okay, so let's break that down. How do those two factors, low blood oxygen and disrupted sleep, mess with the body's ability to regulate blood sugar?
Imagine your body as a finely tuned car engine. It needs oxygen to function properly, just like a car needs fuel. When your blood oxygen levels keep dipping due to sleep apnea, it's like the engine is sputtering because it's not getting a steady supply of fuel. This can throw off various bodily processes, including how your cells utilize glucose.
That's a great analogy. So it's not just about the lack of oxygen, but those constant fluctuations that create havoc in the system.
Exactly. And studies have shown that inducing similar conditions of intermittent hypoxemia and sleep fragmentation in healthy individuals actually worsens their glucose metabolism, lending further support to the idea that sleep apnea could be a causal factor in type 2 diabetes.
This is all starting to paint a very compelling picture. But if sleep apnea is indeed playing a role in diabetes, what happens when we treat the sleep apnea? Does that have a positive impact on blood sugar control?
That's the million-dollar question, and the answer is it's complicated. There's a growing body of research looking at the impact of CPAP therapy, the gold standard treatment for sleep apnea, on blood sugar levels.
Just to remind our listeners, CPAP stands for Continuous Positive Airway Pressure, and it involves wearing a mask at night that delivers a constant stream of air to keep the airway open. What's the research showing about its impact on blood sugar?
There is evidence suggesting that CPAP treatment can improve blood sugar control in people with both prediabetes and type 2 diabetes. However, the findings aren't always consistent across all studies.
What might be contributing to those inconsistencies?
One key factor seems to be CPAP adherence. How consistently people actually use their CPAP machines every night. And for the recommended duration. It makes sense, right? If you're only using it sporadically, you're not going to get the full benefits.
That's a really important point. So it's not just about having the machine, but committing to using it consistently.
Absolutely. Studies have shown that people who use CPAP for at least 4 hours per night tend to see the most significant improvements in their blood sugar control.
So consistency is key. We've been focusing primarily on type 2 diabetes. Does sleep apnea play a role in type 1 diabetes as well?
While type 1 diabetes has a different underlying cause than type 2, research is beginning to uncover a connection to sleep apnea there too.
Really? Tell us more about that.
Although research on sleep apnea and type 1 diabetes is less extensive than for type 2, studies indicate that people with type 1 diabetes also have a higher than average prevalence of sleep apnea. This suggests there might be some underlying mechanisms connecting these conditions, even though the primary causes of the diabetes differ.
So it's not simply about insulin resistance in this case.
Exactly. One intriguing area of research is the link between autonomic neuropathy, a complication of type 1 diabetes, and an increased risk of sleep apnea.
For those who might not be familiar, can you explain what autonomic neuropathy is?
Autonomic neuropathy occurs when the nerves that control involuntary bodily functions, like breathing, heart rate, and digestion, become damaged. It's a common complication of long-standing diabetes. And because these nerves also play a role in keeping your airway open during sleep, damage to these nerves can increase the risk of sleep apnea.
So in type 1 diabetes, it might be nerve damage that's contributing to the development of sleep apnea. It's fascinating. It seems like the relationship between sleep apnea and diabetes, whether type 1 or type 2, is a bit of a two-way street.
You're right. There's a growing understanding that these conditions can influence each other in complex ways, which further underscores the need for healthcare providers to consider both conditions when treating patients.
It seems like we're really starting to understand the importance of a more holistic approach to diabetes management. It's not just about blood sugar levels, but recognizing the interconnectedness of various systems in the body and how factors like sleep can have a significant impact.
I couldn't agree more. It's a crucial reminder that addressing sleep disorders like sleep apnea should be an integral part of managing diabetes, not just an afterthought.
So what's the key takeaway here? What should people with diabetes, or those at risk of developing it, do with this information?
The message is clear. If you have type 2 diabetes, or even hypertension, you should be evaluated for sleep apnea. Early diagnosis and treatment could lead to better blood sugar control, lower blood pressure, and potentially even a reduced risk of developing diabetes in those with prediabetes.
I wholeheartedly agree. It's about being proactive and having open conversations with your healthcare providers. Don't be afraid to ask about sleep apnea, even if they don't bring it up first.
You are your own best advocate. Being informed and proactive can make a real difference in your overall health and well-being.
This has been an incredibly insightful discussion so far, and we've only just scratched the surface. There's so much more to explore about this complex relationship between sleep apnea and diabetes. Stay tuned for part 2, where we'll dive deeper into the research, including the intriguing role of REM sleep, and discuss what steps you can take to prioritize your sleep health.
And we're back continuing our deep dive into the intriguing world of sleep apnea and diabetes.
You know, it's amazing how much research has emerged in recent years, revealing just how deeply these two conditions are connected. Before we went to break, we were discussing how treating sleep apnea, particularly with CPAP therapy, can positively impact blood sugar control. But the sources also highlight some fascinating details about the different types of sleep and their relationship to both sleep apnea and diabetes. Can we delve into that a bit more?
Absolutely. One area that has particularly intrigued researchers is the role of REM sleep.
REM sleep. That's the rapid eye movement stage where we typically dream, right?
That's the one. And it turns out that sleep apnea occurring during this specific sleep stage seems to be particularly problematic for individuals with diabetes.
Why is that? What makes REM sleep so crucial in this context?
Well, for people without sleep disorders, REM sleep actually helps to lower blood sugar levels. It's believed to be due to the increased brain activity that occurs during dreaming, which requires more glucose for fuel.
So our brains are like little glucose guzzlers when we're dreaming. That's pretty cool.
It is, but here's the catch. When someone has sleep apnea, Those breathing interruptions during REM sleep disrupt this natural blood sugar lowering process.
So essentially, their bodies are missing out on that beneficial dip in blood sugar
Hmm.
because the sleep apnea is interfering.
Exactly. And this can lead to higher blood sugar levels, specifically during those REM cycles. One of the sources cited a study that specifically looked at the impact of sleep apnea during REM sleep on blood sugar control in people with type 2 diabetes.
What did that study reveal?
The study found that the severity of sleep apnea during REM sleep was directly correlated with higher HbA1c levels.
To clarify for our listeners, HbA1c is a measure of.
Hemoglobin A1c. It provides a long-term overview of a person's average blood sugar levels over the past 2 to 3 months.
So a higher HbA1c indicates poorer blood sugar control over time. And this study showed that the worse the sleep apnea was during those REM sleep periods, the worse their blood sugar control tended to be. That's pretty significant finding.
It is. It suggests that the timing of sleep apnea throughout the night might be just as important as the overall severity.
That's an interesting point. It highlights the need for healthcare providers to consider not just whether someone has sleep apnea, but also when it's happening during their sleep cycle.
Precisely. And this has implications for treatment as well. If someone is using CPAP but only for a few hours at the beginning of the night, they might be missing out on treating those crucial REM sleep periods that occur later in the night.
So even if someone is technically using CPAP, they might not be reaping the full benefits if it's not timed correctly to address those REM-related disruptions.
Exactly. And that could explain why some individuals see less improvement in their blood sugar control with CPAP. Even if they're using the machine, they might not be using it long enough to cover those key REM sleep periods.
This is such crucial information for people to be aware of. It underscores the importance of working closely with their doctor or sleep specialist to ensure they're maximizing the effectiveness of their CPAP therapy. Now, we've been focusing heavily on the connection between sleep apnea and diabetes. Do the sources mention any other health conditions where this link might be relevant?
They specifically mention hypertension, also known as high blood pressure, as another condition where sleep apnea screening is extremely important.
That makes a lot of sense. High blood pressure is already a major risk factor for heart disease and stroke. And we know that sleep apnea also puts additional strain on the cardiovascular system.
Exactly. Studies have shown that people with high blood pressure have a significantly higher likelihood of also having sleep apnea compared to the general population. And similar to what we've seen with diabetes, treating the sleep apnea can often lead to improvements in blood pressure control.
So it's yet another compelling reason to get evaluated for sleep apnea, particularly if you have other health conditions like diabetes or hypertension.
Absolutely. Early diagnosis and treatment can make a world of difference in managing these conditions effectively and reducing your overall health risks.
We've been talking extensively about CPAP therapy. But are there other treatment options available for people with sleep apnea?
While CPAP is considered the most effective treatment for moderate to severe sleep apnea, it's not always the best fit for everyone. Some individuals find the mask uncomfortable or have trouble adjusting to wearing it all night. In these cases, there are alternative options to consider, such as oral appliances or in some cases surgery.
Oral appliances, are those like mouth guards?
Yes, they're custom-fitted devices that help keep the airway open by repositioning the jaw or tongue.
And what about surgery as a treatment option? Is that a common approach for sleep apnea?
Surgery is typically considered a last resort, usually for individuals who haven't had success with other treatments or who have a specific anatomical issue contributing to their sleep apnea. There are various types of surgeries, but they generally aim to remove or reduce tissue that's obstructing the airway.
So there's a range of options available, and the best approach will depend on the individual's specific circumstances and the severity of their sleep apnea.
Exactly. That's why it's so important to work closely with a qualified healthcare professional to determine the most appropriate treatment plan.
This deep dive has been incredibly informative. It's fascinating to uncover these hidden connections between seemingly unrelated conditions like sleep apnea and diabetes. And it's empowering to know that there are steps we can take to address these issues and improve our overall health.
I agree. Knowledge is power. Understanding the complex interplay between these conditions can help us make more informed decisions about our health and well-being.
We've covered a lot of ground in this episode, but we still have more to explore. In Part 3, we'll delve into the specifics of how sleep apnea is diagnosed and treated, and we'll discuss some practical tips for prioritizing your sleep health. Stay tuned. Welcome back to the final part of our deep dive, exploring the link between sleep apnea and diabetes. We've uncovered some pretty remarkable insights so far.
Yeah, it has been a really interesting conversation. So Now let's shift gears and talk about what you can actually do if you think you might be dealing with sleep apnea.
Yeah, that's a perfect transition. Because awareness is only half the battle. What's the first step someone should take if they suspect they might have sleep apnea?
The most important step is to talk to your doctor. They can evaluate your individual situation, taking into account your medical history and any other health conditions you might have. Based on that, they can advise you on the best course of action.
Okay, that sounds simple enough. But I know some people might hesitate to bring it up. What are some red flags to look out for? What kind of symptoms should prompt someone to have that conversation with their doctor?
Well, some of the classic symptoms of sleep apnea include loud snoring, gasping or choking during sleep, and excessive daytime sleepiness.
So if your partner is constantly complaining about your snoring, or if you're finding yourself struggling to stay awake during the day, that could be a sign to pay attention to.
Absolutely. Other symptoms that can be associated with sleep apnea include morning headaches, dry mouth, and difficulty concentrating.
Those are all things that could easily be attributed to other causes, though. That's why getting a professional evaluation is so important.
Exactly. A healthcare professional can help determine whether your symptoms are likely related to sleep apnea or something else entirely. And if sleep apnea is suspected, they can refer you to a sleep specialist for a more comprehensive assessment.
Okay, so let's say someone is referred to a sleep specialist. What can they expect? What happens next?
The gold standard for diagnosing sleep apnea is a sleep study, also known as polysomnography.
I've heard of sleep studies, but I've never had one myself. What does that involve?
It's not as intimidating as it might sound. You essentially spend the night at a sleep center, where they monitor various things while you sleep, like your breathing, brain waves, heart rate, and oxygen levels.
So you're basically having a sleepover, but with lots of wires attached to you.
Pretty much. The data they collect from all those sensors helps them determine if you have sleep apnea. And if so, how severe it is. It's worth noting that in some cases, you might be able to do a sleep study at home using a portable device.
Oh, that's good to know. I imagine not everyone is thrilled about the prospect of spending the night in a lab setting.
Right. Home sleep studies are becoming increasingly common, especially for individuals with less complex cases.
Now let's talk about treatment options. We've mentioned CPAP therapy several times, which is considered the most effective treatment for moderate to severe sleep apnea. But are there other approaches people can explore?
Yeah, CPAP is definitely a highly effective treatment, but it's not a one-size-fits-all solution. Some people find the mask uncomfortable or struggle to adapt to wearing it at night. For those individuals, there are alternative options available, such as oral appliances or, in certain cases, surgery.
Oral appliances, you mean something like a mouth guard?
Exactly. These are custom-fitted devices that help keep the airway open by repositioning the jaw or tongue.
Interesting. And what about surgery as a treatment option? How common is that for sleep apnea?
Surgery is generally reserved as a last resort, typically for people who haven't found relief with other treatments or who have a specific anatomical abnormality contributing to their sleep apnea. There are different types of surgical procedures, but the goal is always the same: to remove or reduce tissue that's blocking the airway.
So there's a spectrum of treatment options, and the most appropriate approach will depend on the individual's specific needs and the severity of their sleep apnea.
Absolutely. It's crucial to work collaboratively with a qualified healthcare professional to develop a personalized treatment plan that addresses your unique circumstances.
This brings us back to a point we've touched on throughout this deep dive: the importance of lifestyle modifications in managing both sleep apnea and diabetes.
Yeah, I couldn't agree more. While treatments like CPAP can be incredibly effective, they're not a magic bullet. Lifestyle factors play a significant role as well.
So even if you're using CPAP, it's still important to make healthy choices when it comes to diet, exercise, and weight management.
Absolutely. Even losing a modest amount of weight can significantly improve sleep apnea symptoms, and regular physical activity can improve sleep quality and reduce insulin resistance, a key factor in type 2 diabetes.
I've also heard that alcohol can exacerbate sleep apnea. Is there any truth to that?
Yes, that's true. Alcohol can relax the muscles in the throat, making you more susceptible to snoring and airway obstruction. It can also disrupt sleep patterns and interfere with the effectiveness of CPAP therapy.
So moderation is key, as with so many things in life.
Indeed. And if you're struggling with sleep apnea, it might be beneficial to cut back on alcohol altogether, particularly in the hours leading up to bedtime.
Well, this has been such an eye-opening discussion, filled with valuable insights. I feel like I've learned so much about this often overlooked connection between sleep apnea and diabetes.
Yeah, it's been a pleasure sharing this knowledge with you and our listeners. It's incredible how seemingly unrelated conditions can be so intricately intertwined. Hopefully, this deep dive has empowered everyone to prioritize their sleep health and overall well-being.
I couldn't have said it better myself. Remember, prioritizing sleep is an investment in your health, not a luxury. Addressing sleep disorders like sleep apnea can have a ripple effect, not only improving your sleep quality, but also potentially improving your blood sugar control, blood pressure, and overall quality of life. Thanks for joining us on this fascinating journey. And don't forget to like, share, and subscribe to Visions Beyond for more deep dives into the world of health and wellness. Until next time, sleep well.